Some Americans say that healthcare should be private, that it's a private benefit provided by employers, or it's a private choice made by consumers. Some people say it should be public. It should be a public right that's paid for by a single-payer government plan. And I'm going to suggest to you, based on the research I did, that healthcare is neither private nor public, that it actually is a social good. And what I mean by that is we pay for healthcare and we share healthcare together. So as I look at the healthcare reform debate today, it basically boils down to a choice. We can either make healthcare more of a social good, which is what the Affordable Care Act does, or we can jump over to a more private market-based system where people are paying for their own health plans and their own health coverage more, which is what the current conservative proposal is. Okay, so that's the choice. In deciding where we want to go, it's really important to ask, well, where have we come from? All right? So I want to suggest to you how the social good of healthcare has been built through some brief illustrations, and I'm going to use a balloon to help me illustrate how we have built the healthcare system today. Okay, so the social good of healthcare has two basic pillars. One pillar is public investment, and today government pays for almost half of all healthcare costs in this country. Okay? But in addition to that, there are private-public partnerships. The government provides public funding, and then for-profit organizations use some of that funding, and nonprofit organizations especially build the healthcare system on that basis. Okay, public investment really takes off in the 1940s. So here's healthcare in the 1940s, right? There's already some air in the balloon, that's great. One of the places that the public really started investing heavily first is medical research. And by 1950, the public was spending 40% of medical research dollars in the country. Okay, so 40%. Right, that means private industry is pumping in another 60%, so that's a lot. But actually, if you include public health dollars outpace private medical research funding. Big public puff. Okay, now let's talk about medical education. Med school costs a lot of money. $3 billion a year. Wow. How much does the public spend on medical education for med schools and residency programs? $18 billion, 6 times the amount. Wow, that's a lot of money. Okay, so now let's talk about public insurance. There are two big public insurance plans, Medicare, Medicaid. And they really profoundly changed healthcare when they were introduced in 1965. And just to give you a quick sense of that, economists estimate that when Medicare was introduced in 1965, by 1970, healthcare costs had risen 25%. Big puff. Now why? Because now there's a guaranteed funding stream and people can invest in technology much more. Okay, now let's talk about private health insurance. Thank goodness the public isn't doing anything with private health insurance, right? Wrong. Tax deductions, right? Tax deductions for private health insurance cost over $250 billion a year. Oh my goodness, we're running out of air in this balloon, right? Okay, what about the safety net? Medicaid is a big contributor to the safety net, but I'm actually going to talk a little bit more about uncompensated care for uninsured people. There's a 1986 law that says if you present an emergency room, you have to be stabilized with care. So that basically means there's a back door into the healthcare system. In fact, it's become the front door because emergency departments are now the front door of hospitals, right? Well, this costs hospitals about $10 billion in unrecovered costs each year. But the government actually spends $30 billion helping hospitals meet that obligation. Okay, so here we are. Here's the social good of healthcare. What have we gotten for all this investment? I want to suggest we've gotten at least 4 things. We have helped invest in innovation in medical research, excellence in medical training. We've invested in equity for elderly Americans, and to a lesser extent for poorer Americans too. And we've built a kind of basic solidarity, not a complete solidarity, but a basic solidarity for uninsured patients. This is where we stand today. This is the social good of healthcare. All right, now to say it's a social good doesn't necessarily mean it's good for everybody in society, right? In fact, the sharing of costs and benefits is very uneven, it's unjust, and it's incredibly expensive. So this brings me to a comment I heard from one of my research interviewees, who's a senior vice president of a Midwestern healthcare system, and he's the one who gave me this idea. He said, you know, healthcare is a balloon. We went through the dot-com bubble, we went through the housing bubble, and now we're in the healthcare bubble. He says, we're entering an era of shrinking reimbursement, and somehow the air has to come out of the balloon. And the question is, how will the air come out of the balloon? The Affordable Care Act lets the air out of the balloon more slowly. And we all know what that sounds like. Oh my goodness, there's so much complaining, there's so many problems, there's so much creaking of the healthcare system because we've got this Affordable Care Act now, right? But what's the alternative? If we go to a system where people are paying for their own health plans and their own health services, what happens to these public funding streams, right, that have built values in the healthcare system? I have no idea, and nobody else does either. Okay, so that's the practical question facing us today. There's also a moral question facing us today, and that moral question is this: should Americans ensure basic healthcare access to everyone living in this country? This is an issue that was debated in the Supreme Court oral arguments over the Affordable Care Act back in 2012. And I'm going to relate a quick exchange between Donald Verrilli, Solicitor General of the United States, and Justice Antonin Scalia. So Verrilli was defending the individual mandate that people have to have health insurance. And the question is why? He said, people are going into the healthcare market without the ability to pay. But they're getting the healthcare service anyway because of social norms that we've obliged ourselves to ensure that people have basic access to care. And Scalia said, well, don't obligate yourself to that. Okay, well, that's really easy to say on an individual level. Americans like this idea that healthcare is my choice. Don't force me to have healthcare coverage. But once you expand that to a society-wide level, if everybody's really paying their own way, paying their own coverage, and paying for what our services, that means some people are not going to be able to afford access into the healthcare system. And we really have to face that reality, that some people will not have access to this social good of healthcare that we've built. So here's the take-home message. Individual benefits, individual costs, and individual responsibility in healthcare occur in a context of shared responsibility. That's just the way it is. Okay? And the Affordable Care Act builds on that. I'm not going to talk exactly about how it builds on that. I'm going to jump to the Healthy Indiana plan. So Governor Mike Pence has expanded Medicaid through the Healthy Indiana plan recently, and I applaud him for doing so. And he says this is about personal responsibility because new Medicaid recipients, they're going to have to pay for a lot of their services because they have a high deductible. They're going to have a health savings account that they have to make monthly contributions in, and then the public will put in money too. So it's about personal responsibility, except that it happens in a context of shared responsibility because taxpayers are going to pay most of the bill, right? And that's just the way it is in healthcare. Now we have a challenge facing us today. Personal responsibility for Medicaid recipients, shared responsibility for taxpayers. Is there any way we can bring these two values together? And I want to suggest that we can, and that we Hoosiers should individually ask ourselves, those of us who know the healthcare system, have health insurance, would it be possible to mentor newly eligible Medicaid recipients to help them on their journey into healthcare for the first time? Right? In fact, many people are not going to be able to pay the monthly contributions that they have to make, and many people are unbanked. So what are we going to do as a state, as a community, as a society to help people make HIP 2.0 work for them and work for our society in general? And this is an opportunity, I think, for organizations, religious congregations, civic groups, and IUPUI, and other organizations, universities, to call on individuals to try to find ways to support HIP 2.0 enrollees on their journey into healthcare. HIP 2.0 is about personal responsibility, it's about prevention and wellness, it's about fair pay for quality primary care, and it's also about decreased use of emergency rooms and acute care. We should all care about these values, and we should try to figure out ways that we can invest in and make this a shared responsibility for all of us, because healthcare only works if everybody is in it together. Thank you.